Okay, this is Dr. Talari. I want to do a video about how Australian medical students practice their OSCE or clinical exams. This is a role play recording of me teaching Australian medical students. So I've recorded the role play. So when I'm playing it here, I wanted to learn from the mistakes of Australian medical student. So without wasting time, let me just play the video.
Okay, all right. And I'm working in the ED and hoping to help you with your palpitations.
Sure.
So can I just start by getting your full name?
It's Mr. Thomas Benstein.
So the doctor introduced herself or the medical student and she asked the full name of the patient. And just see what happens after here. This is a 65-year-old man who presented to the emergency department with palpitations.
Mr. Thomas? Is Thomas okay?
Thomas is fine.
Okay, yeah.
So even if it's an OSCE, one thing you need to understand is you need to take it seriously. You should never laugh. If it's your friend, it doesn't matter. If you're doing OSCE, you have to be serious, especially when it's a 65-year-old man who presented to the emergency with palpitations. So you have to be serious. The tone should be empathetic. This is very, very important. See, even Australian medical students who practice communication skills a lot struggle with communication skills. The reason I'm doing this video is I want you to practice a lot on communication skills because English is not first language for most of you. It was not first language for me as well. When I first came to Australia, I went outside. A couple of kids were playing cricket and one of the dad was there. So they were actually asking me if I want to bowl. I couldn't understand what they were saying. This is first day in Australia. I still remember July 13th, 2007, I came to Australia. I did not understand a single word of what the dad was telling me. All I knew is he was telling me to bowl or he was asking me if you want to bowl. So communication skills are very, very important. As a doctor, these are literally the number one skill we need to have is communication skills. And that has so many things like empathy, asking ethically appropriate questions, culturally appropriate questions, asking proper English questions, avoiding jargon. So many things are there. So let's go into the next phase of the scenario.
And you're 65, is that right?
Yes.
Yeah, okay. And are you working at the moment?
I've just retired actually.
Oh, okay. From what kind of job?
As a teacher.
Okay, all right. So how can I help you?
Look, I just feel like my heart's racing.
Okay, has this ever happened? And I'm working.
So, so the patient has said, I feel like my heart is racing. And the doctor or the medical student started asking closed-ended questions straight away saying, has this ever happened? See, this is the mistakes people do. When you're under pressure, you do a lot of these mistakes. So the lesson from this is have a structured approach. Be empathetic. You should have empathy when someone is saying something and be organized in your history taking. So this is where you need to be calm, think properly, and have your step-by-step approach where you don't miss anything. If you would like to know more videos like this, I'm going to do more videos about this particular role play because I've divided into 30-second slots and I'm going to do more of them. So if you want to get all the videos, make sure you subscribe to the YouTube channel or there is a Facebook group and I will be posting in all the Facebook groups. Lot of Facebook admins, I think they do AMC teaching or pesky teaching. So whenever I post something like this, they don't approve this post. So what I wanted you to do is, can you please share this post with every IMG you know? That way I don't have to go and literally beg all these group admins to actually approve my post. So when I post a video, and mostly it is a value-based video, something like this, I'm not selling anything here, and the admins don't approve the post, So what I wanted you to do is, wherever you see this, get this link, share this with every international medical graduate or someone you think will benefit from this. If you're watching this in a Facebook group, make sure you tag people. And also, if you know the admins, tell them that they should approve this video links, because a lot of admins are not approving any of my posts, not even a single post. I think they're worried that I'll be a competition to them, or I don't know what it is. But there's nothing here to sell. Maybe in the future I might sell something, but at this stage I don't want to sell anything because I'm very busy. It's winter time here. I don't want to sell anything, or I used to sell courses. I just want to give a conflict of interest. There were some issues with some students saying I was charging more, so I stopped. I didn't bother because then I got into medical practices and other businesses, so I got completely out of medical education. But recently, when one of my clinic doctor passed, and she was telling, Dr. Talari, you should teach a lot of students, because hundreds of students out there or thousands of doctors are struggling. She said many people in the groups are struggling. They are worried that they will fail. And that's when I thought maybe I should do it, because this is something I love teaching. I love doing videos for candidates. So anytime, I will never take a gun, put it on you and say you have to buy my course or you have to give money to me. These videos are free videos, so you can watch it and you never have to buy anything from me ever in your lifetime. I will never force anyone to buy. But if you want to buy the courses to get fast results, that's fine. But I'm not selling them at this stage. I may sell it later this year. I don't know when I will sell it, or I will never sell it. But I want to do some videos purely because one of my clinic doctors said what all I taught helped her pass the AMC Clinical. And this is something I was very passionate. I love teaching for AMC Clinical. So that's why I'm doing this video. So if you want to help your fellow IMGs, make sure you post this video. If you're watching this in Facebook, make sure you go on the comment section and tag all your friends, so everyone will be aware of this video. And I don't have to literally go and beg these group admins. And if you know group admins, make sure you tell them that if they have the best interest to help IMGs, then they should let me post these videos in their groups. And if someone is not posting, they don't have the best interest of you. So with that, make sure you subscribe to my YouTube channel, because I will be posting all the videos there and sharing them, because it's easy to get a link and just get the subtitles and all those things and share it in all the groups. So I wish you all the best, and I will see you in the part 2 of this role play video, where the doctor does more mistakes and I will explain them to you.